Almost half of Nigerian population nowadays experience depression resulting from different factors. Social problems such as poverty, lack of opportunities for self-actualization, poor standard of living, increasing individualistic style of life, student failing to pass exam, student or parent failure to pay school fees, among many others, are the sources of depression in Nigeria.
In the hospital, it's not just social causes. There are other causes, biological causes. People can have problems. For example, they're hypertensive and they become depressive because of hypertension. They have diabetes and they end up with depression because they're asthmatic and they become that. Sickle cell anemia, they have that. That's a biological cause.
The family support, the social support we used to enjoy from our kinship is no longer there. It's withdrawn. Governmental support, institutional support is not available, it's not forthcoming, it's withdrawn. So people are left on their own. If it is poverty, it is their own palaver, it's their own problem. If it is illness, well, that's their own cup of tea. If it is collapse in business, well, it affects you only. And that lack of social support is a factor.
I've been through depression. Now, there was this time that I couldn't even just pay my school fees in this school. And then, for some reason, the school has a policy that if you don't pay your school fees, you cannot defer. It was difficult for me. At that particular time, I felt useless.
At the moment, for me, I'm depressed because I received an invitation to meet with one of my supervisors, and then I really had to come down here. And where I was, I had other things to be doing. As I'm sitting here now, I don't even know whether I'm going to see him or not.
Depression manifests through insomnia, loss of appetite, palpitation, isolation, boredom, and in worst case, attempt at suicide.
According to the WHO, World Health Organization, every year, 1 million people commit suicide around the world. 800,000 to 1 million commit suicide. And most of the people who commit suicide are within the developing countries, the bulk of them. So many. Even though we have more reports from the Western world compared to what we have here. Now what they found out is suicide has a reason. And some of the reasons, depression is one of the major causes of suicide. 60% of people who commit suicide, 6 out of every, if you count 10 people, 6 out of 10 people commit suicide, they are depressed.
Experts put it that due to cultural reasons in northern Nigeria and Kano in particular, women suffer more depression than men, as they bear a lot of burden supposed to be shouldered by men.
Most of the experiences that leads people to depression, especially women in the northern part of Nigeria, some of them are divorce. We have records have shown a huge number of divorce cases, especially in northern Nigeria, that has dragged many women into depression as a result of the aftermath of the divorce.
It happened to a closer relation of mine. She married somebody that has a wife, and she's the second one. She asked that person, he asked that person that, can you be able to take care of me?
Before the marriage?
Yes, before the marriage. And on your responsibility, he said, yes, I can do it. Are you sure? He said, yes. She interviewed him, are your children going to school, blah, 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 and so on. After all, when they get married, I'm telling you, he could not afford to take care of her. He's only giving her 100 naira or 200 in a day. So it becomes a problem to her. And she wanted to end that marriage, but she said, how can she end the marriage? After all, the marriage did not last long. And people will start saying she's not patient. She didn't want to live with the first wife in one house. She had wanted a separate house. But due to the husband cannot cut her also to give her a separate house, it also becomes another problem for her. I'm telling you, that depression compiled to her. We took her to the hospital. She started taking the drugs. We took her to Dawano. She started taking the drugs. It was not long last she died.
In the northwestern part of the country, whereby women were traumatized, raped, displaced, have their husband killed before their eyes, have their children killed before their eyes. And for those who are lucky to still be married and have their husbands alive and children, the husbands withdraw all the familial responsibility.
To reduce the extent of depression, social, psychological, and medical approaches must work. Possible sources of depression must be avoided.
We need to take them where they should be helped. Sometimes people come to the hospital, other people you give them drugs, others you don't. You see, there are two ways of doing this. You don't only give people drugs to treat depression, no. What do? You sit the people down and you talk to them and you change people's way of thinking, you change their behavior.
It is important that civil society organizations, the federal government, and other medical agencies to put hands together and to create a loud and massive awareness around mental health, so that it will help us understand first the first aid for mental health and the first aid for depression, which is psychosocial support. Because if we are having a rising number of people depressed, we're beginning to record a loud number of people committing suicide. It means there is a need for preventive measures rather than curative measures.
Psychiatrists may give pharmacological therapy. Clinical psychology, psychosocial analysis may be psychosocial and cognitive therapy. That is one way to attend centers where those services could be provided. Where there are no such centers, government should provide sufficient centers. This deliverance in churches is supposed to be the work of sociologists, supposed to be the work of psychologists, supposed to be the work of psychiatrists. The Ruqyah issue clinic, there's nothing like evil spirits. Nothing like evil spirits. It's purely depression. This is a work of psychiatrist. This is a work of sociologist. This is a work of psychologist. This is a work of guidance and counseling expert.